Hello, I'm Dr. Marla Shapiro, and I sit on the Board of Trustees of the International Menopause Society. And today we're going to be talking about vulvar disease with Dr. Céline Bouchard. Dr. Bouchard, if you could introduce yourself to our audience of practitioners.
Oh, thank you, Marla. I am Céline Bouchard from Quebec City, the French part of Canada. I am gynecologist. I am a fellow of the ISSVD, International Society for Vulvovaginal Disease. I am also a vice president of the Canadian Menopause Society and working with you, Marla, and the continuing education committee of IMS. I am also on the board of Menopause Journal and GUGC Journal. So that's me.
Well, we're so lucky to have you. So let's first talk about, for general practitioners and practitioners caring for women, what some of the most common symptoms of vulvar disease are. What do we mean when we talk about vulvar disease?
The most common symptoms for sure is pruritus. Itching is very common for postmenopausal women. And I must say that the most principal cause is SGM, syndrome, GSM, sorry for my French translation, genital symptom of menopause. So it's the main cause of pruritus of women. And the other cause is burning. Yeah, you can feel burning. So pruritus is burning are the main symptoms for women, postmenopausal women.
So when we're starting off with women who have some of these complaints, let's talk about some basic information that we as practitioners can offer our patients. So let's talk about firstly basic things like genital hygiene. What is it that women should know when we are educating them?
First of all, do not wash too often. Once a day it's enough. Sometimes we can see patients doing a lot of bathing, and it's 2-3 times a day. It's too much, and you have to keep the hydrating skin. For the health of the vulvar healthiness. So I will say that maybe not take any douches, vaginal douches. Don't take a bath too long. Don't take the water too hot. Don't use any deodorant or scented soap. Or don't use any cosmetic or deodorant product at the vulva. That's the basic of advice that we have to give to the patient.
So beyond the itching and the pruritus, when we're looking at some other causes that we need to be aware of, talk to me about vulvar dermatosis and the associated symptoms and what we mean by that phrase, vulvar dermatosis.
By that phrase, we need, a skin disorder. The most representative diseases are lichen planus and lichen sclerosus. I can talk about lichen planus first of all. Lichen planus is a rare condition. It's 1 on 4,000 patients. The patient will present to you with at the beginning with a symmetrical redness of the vestibule at the entrance of the vagina. And they have a lot of pain. It's a suffering disease, a very suffering disease. They feel a burning sensation all the time at the vestibule and the specific area of the vulva.
And if we go on from lichen planus to lichen sclerosus.
So the lichen sclerosus is more frequent, and it's the most frequent skin condition seen by gynecologists. Is 1 of 1,000 patients. It's a condition that is pruritus. The main symptoms is pruritus more than lichen planus. The pain is not there. It's there when they have intercourse or intimacy. But the main symptom is pruritus, so a lot of pruritus. The dermatosis, the problem with lichen sclerosus, and lichen planus, it will modify the architecture of the vulva. It will, the labia minora will disappear. You will have a hidden clitoris. You will have a loss of elasticity of the tissue. you can have fissure at intercourse in the both condition. One of the things that I want to add is with lichen planus, you can have the disease can go to the vagina with synechia and stenosis of the vagina. So you can need some surgery to remove the synechia of the vagina. Well, lichen sclerosis, you don't never reach the vagina. It's always outside. The appearance are not the same. Lichen sclerosis is a white, ivory white patchy lesion of the vulva. It's around all the vulva, and it's a form of an 8 going up to the anus area. So it's, and the perineum is often a point of disease.
Now, can these lead to any types of malignancies, things that we should be aware of if they go untreated?
Yeah, mostly lichen sclerosis is 2 to 4% of the patient will develop epidermoid cancer of the vulva. So it's very important for healthcare provider to be very attentive to the appearance of the vulva. When you have a thickness of the lesion, a spot, a bump, or a redness in the lesion of the lichen sclerosis, you can be very attentive and do biopsy of the lesion, because you can have a precancerous lesion and you can have a cancerous lesion, and it's all surgical with the removal of the lesion.
So this is something that for a general practitioner or a non-practicing surgical gynecologist that really would merit referral.
Yeah. For lichen planus, is the main disease is pain, and it's difficult to treat. So, but fortunately, it's rarer to develop a cancer. It's 0.3%. So the condition is suffering, but you know, for cancer, it's less important than lichen sclerosis.
So aside from these two, are there other vulvar cancers that we should be aware of?
Yeah, for sure. You can have a HPV-related cancer and the HPV, but in general, the population will be younger, 60 years old, compared to the patient with cancer with lichen sclerosis. The patient is around 70, 80 years old. It's a long process. But HPV, the patient are younger, and it's secondary to high-risk human papillomavirus infection. And it's some, you know, plaque like a brown plaque or gray plaque. It's not totally white, it's more gray or brown, and it's localized, and you have to do a biopsy. And this can happen having epidermoid cancer with time. Unfortunately, it's less advanced than very often than lichen sclerosis, and the survey is better with HPV-related cancer than lichen sclerosis.
So this really points out the fact that often when women are older and they're not sexually active and we're not doing PAPs on them, that we forget the importance of visually inspecting the vulva. So what are the signs and the symptoms of vulvar cancer that we should be aware of?
It's mostly either a light lesion or a dark lesion, either a lump or a bump, or either a sore, a persistent sore of the genital area. So that's the most important point. And the thickness of the skin localized is important in a lesion in a lesion, you understand? So if you have a thickness in the white area, in the white area. Surface, localized surface with thickness, you have to biopsy that, because you know you can have a precancerous lesion or cancer in that lesion.
Is it possible for women to have signs of vulvar cancer without necessarily having symptoms? In other words, they don't have itching or burning, but there's something that we see on visual inspection.
It's mostly, yes, for melanoma. Mostly melanoma doesn't have itching, you know. The majority, they present because they have a dark brown, so elevated lesion on the vulva. It's a change of melanocytic nevus of the vulva. So yeah, the melanoma, they will not have symptoms. But the other, yes, they have symptoms because they have pruritus. Most of them have pruritus and pain, and sometimes they bleed. The lesion can bleed also.
So it's truly important for us to remember that these symptoms that present, we should not be ignoring, and that we should be, at the very least, inspecting.
At least just a look to help a patient, because a lot of patients in Canada, a lot of patients now don't have any family physician anymore. So it's very sad. They arrive at my office with a lump. It's a stage 1 cancer. They have to have a radical surgery of the vulva. It's very sad because they are 75 years old, and it's an evolution of a lesion from a long time evolution. So it's very sad to see that kind of lesion that nobody think to look at the vulva of the patient. It's a very important organ for the women, the vulva.
And I thank you so much for pointing that out to us, because for many of us, we forget about the importance of doing the inspection once we're no longer doing Pap tests. Thank you for joining us today and sharing your information with us.
Thank you, Marla.